Hello, everyone. It is a privilege to be a part of the NSF Accelerator Program Liberate. My name is Ravi Nataraj, and I'm an assistant professor at Stevens Institute of Technology in the Department of Biomedical Engineering. The title of my short talk is The Need to Personalize Assistive and Rehabilitative Technologies. My humble objectives for this mini talk are to hopefully better motivate even further consideration of personalization than what is already being done in developing and deploying assistive and rehabilitative technologies. And then also I'm looking to provide a few guidelines in further consideration for personalization. So available and developing technologies are inherently personalized with several devices providing specific levels and types of assistance or rehabilitation depending on the specific needs. For example, with mobility, passive devices in which the user must continually provide input may be most appropriate for a person who is capable of independent functions such as walking, but requires an aid such as a cane for support in order to ease their burdens while walking. Active devices, which include powered exoskeletons, have an external power source from which to then inject energy into the function, may be best for a person who is not otherwise capable of a particular action, such as standing or walking, from which to better engage in mobility exercises. Certainly, devices and aids for other functions, such as vision, hearing, communication, have similar considerations for personalization and come in various options in personalizing which device choice is best. Unfortunately, there are other non-functional factors, such as affordability and accessibility, that play crucial roles in identifying practical options for personalization. And these factors really need to be further considered and addressed in the development of these technologies in order to ensure impactful and mass deployment of such technologies. So beyond functional restoration or assistance, the need to personalize technologies is driven by ensuring that the tech is a good physical fit to the user. Fitting at the physical level is fundamental to usability. If it's a wearable technology, certainly it must match or be congruent with the person's physical anatomy. It needs to have a certain physical ease of use in restoring some physical function or ability. And it's best, if possible, for the tech as it may apply to be physically cosmetic. While fitting users with technology on functional and physical levels is in fact necessary, the question becomes, is it sufficient? I would contend that a major frontier of personalization that is not as readily considered is fitting on a cognitive level. It's really at this level where there can be more mental buy-in with the user. So on a first cognitive level, we can ask, is the technology basically fun? Is it a technology that has the person feel very motivated to use the technology beyond core functional and physical specifications? Also on a cognitive level, we can ask, how does the tech make someone feel? Not just about the technology, but about themselves while using the technology. Does the tech facilitate feelings of empowerment and pride? And also on a cognitive level, we can ask whether or not this technology may accelerate positive outcomes by making the user feel engaged to facilitate higher usage. And then does the tech itself inherently facilitate faster learning of the device by the user? These may be the pathways ultimately that ensure clinical acceptance and retention of such technologies. So depending on the specific technology, admittedly, personalization considerations of fun, empowerment, and faster learning may not be as feasible, but however, to whatever extent those considerations are feasible, I do believe it's very worthwhile to explore those considerations during the early design phases. Certainly one type of technology that is absolutely capable and should consider such cognitive level factors are those technologies that rely on computerized interfaces. So these interfaces are programmable. As such, they are readily flexible and customizable for individual users. They can provide unique environments that may be created to allow the user to feel more immersed. They can present to the user gamified features while practicing physical task activities. This type of training is readily practiced as part of VR rehabilitation protocols. There's an opportunity with these types of interfaces to also integrate instrumentation, such as robotic trainers or wearable monitors. Ultimately, these interfaces can and should provide a multitude of options for personalization. As such, there's an onus on the designer to identify and provide the user a space of viable and effective options to explore. So to effectively personalize the user experience, designers should identify features for deployed technologies that will achieve multiple beneficial objectives. Not only should there be a surpassing of desired thresholds for functional performance, there should be facilitating of positive psychological perceptions, again, not only about the device, but also about the user. And furthermore, the users could be queried through surveys about their perceptions of control or sense of agency over the device. Several studies, including work from our own lab, have established the functional level benefits of having a higher sense of agency. So finally, to the extent it is possible or practical or simply makes sense, designers should consider what tech features produce desirable physiological responses to the users. Typically, the goal in this case would be to ensure greater user well-being through reduced stress level responses while using the technology. So hopefully the users are now gifted by the designers with a plethora of options in utilizing the technology such that they can now essentially create or customize their own tech to the extent that it's possible. Certainly with computer interfaces, there may be selections or preferences that are allowed with respect to preferred colors or themes or personal elements to include as part of the interface. Ultimately, the goal is to provide the user with as much ownership and facilitate a greater sense of personal investment and empowerment over the device. In conclusion, I hope there may be greater consideration of cognitive level personalization of these technologies as is or whenever possible. While the most important and fundamental considerations with these devices should continue to be safety and effectiveness, I believe fostering user feelings of investment in the technology may be key for long-term clinical acceptance and retention of such devices. So thank you for your time. For anyone interested in having a deeper conversation about this or related topics, please feel free to reach out to me via email at rnataraj@stevens.edu or check out the work that our laboratory is doing that involves virtual reality and instrumented technologies for motor rehabilitation of persons with brain or spinal cord injury at www.mocorlab.com.